Hi, I'm Allison Rollans, owner of High Country Doulas. I'm a postpartum and labor doula, as well as a childbirth educator, a health coach, and several other things that I could add in there. But I'm here today to share a little bit more about what is a doula, what it takes to be a doula, what is the role of the doula and the career path to becoming a doula. And I'm here with my good friend Lisa Vance.
Hi, I'm Lisa. I'm a certified nurse midwife, and so I was just going to speak a little bit to the track of becoming a certified nurse midwife. So, do you want to go first?
Sure. So, the path to becoming a doula, and a doula is a woman who provides non-medical support and education, both emotional and physical support to women and their partners as they go through their pregnancy, through their labor and birth, and into their postpartum. As a childbirth educator, I provide a lot of different classes to families that they can learn more about what to expect in birth and to be able to know their options and to be able to know how they can support one another through that experience and just have a really positive experience. I work collaboratively with a lot of providers such as Lisa, obstetricians and gynecologists, as well as other providers that provide support and care to women during that time, and really just try to create a very collaboration of sort of what we would call the birth team of that woman and her partner. It really creates a better quality of care for their experience, and usually most of our clients are first-time moms. However, we do help support experienced parents as well. So I love teaching about childbirth. I love teaching about infant feeding, how to breastfeed, bottle feed, how to pump when you're going back to work. So important. And I also love teaching about newborns. So parents really get focused on childbirth, and that's one of the things that is sort of a worry or anxiousness for a lot of parents, like getting through that point, so much so that they forget about the after part. And so I really want parents to be able to have a little bit of understanding of what that looks like, what newborn sleep looks like, what's that reality, what is, that how am I going to comfort my baby when they're upset? How can I make sure that I get the best recovery that I can as a mom, whether I'm recovering from a vaginal birth or cesarean birth? So many different pieces of that puzzle, and also just how can dads and partners support mom and baby at the same time, because it can be really important, and just give them a couple of tools makes a huge difference in that those first couple of weeks home with baby. So getting to that point, I've taken lots of different doula trainings. I'm a lifelong learner, and I always encourage people who are interested in the doula career to talk to other doulas to know, what does that look like? What does it look like to be an on-call life? Who should I get trained with? How do I get clients and those kind of things? And so there's lots of different options there. I encourage people to come and call me or email me and find out more about it. We'd love to come and deliver another meeting workshop so that you can learn more about it if you would like that. And getting trained is just a piece of learning to become a doula. You also need to know how to get clients and those kind of things. And at High Country Doulas, we do work with doulas to help connect them with families so that they can have those experiences and gain that knowledge and understanding of what it looks like to work with families as a doula, whether that's labor or postpartum. Our personal favorite organization that we work with is Pro Doula, and it's one of the many organizations that you can go to for training. There's also DONA, Kappa, Birth Arts International. There's many different ones. I do encourage people to do an in-person training. I think it's really important to have that hands-on training versus anything that would be online or virtual. The type of experience and the quality of the learning is tremendous with a in-person training. So beyond that, what other questions can I answer? I don't know. Maybe Lisa, you can share a little bit about becoming a certified nurse midwife.
Sure, I could share, and then maybe I could throw some questions questions at you that I've had people ask.
Yeah.
So I'm going to speak to just a certified nurse midwife. So there are other paths to becoming a midwife and different, that can be confusing, the different pathways. But I'm just going to speak specifically to a certified nurse midwife, which is honored in all 50 states. And so what I did is I went to nursing school first, and so you, CNM has to maintain a nursing license. And then I worked on labor and delivery and fell in love with that. And so when I knew that I wanted to become a midwife, it requires that you go back and get your master's degree in nursing. And so it's very similar to a nurse practitioner. So I do kind of explain that to people who are unfamiliar with the profession, that it is like a nurse practitioner. So I do have the ability to prescribe when necessary and to treat moms all the way from menarche, which is when a young woman gets her first period, all the way through menopause and beyond. And so our scope of practice is basically that, and I can only treat women. And so I really kind of honed in on this specific niche so that I could really zero in and learn more and teach more specifically. This was just a passion of mine. So that's the difference between a certified nurse midwife and a generalized nurse practitioner. So it's just more specialized for women's health and GYN and OB. So I'm also heavy in the procedure aspect because, of course, delivering babies. And also we do some minor suturing. We are trained to deal with childbirth emergencies, and then of course have our trusty OBGYNs as our backup physicians. So it is very important that we have this relationship that is professional and also just very respectful of each other's qualities and what we're all able to provide and bring to the table, just to optimize the experience for that mother and to make it the best possible experience for her. And even if there's an emergency, and how we manage it and how we call for backup and all those things. And so I guess it kind of sounds simple, but it does take some years, I suppose, of nursing school and master's degree to get to that position, to that spot.
So you went to a 4 years to get your RN?
So I actually did an accelerated nursing program. So it was considered a bachelor's in nursing. I went to Duke, and so they had an accelerated BSN, which ETSU offers as well. So there are local accelerated nursing programs. So I had a bachelor's degree in biology, which I'm not using, but I did get that first, and which gave me the prerequisites. So there are prerequisites that you would need to get for nursing school. So let's say that you, let's say you're a teacher and you decided you wanted to become a midwife, a nurse midwife. So you could do this accelerated nursing program that's usually about 14 to 16 months, and then go on to get your master's degree, which is usually about 2 years. And so, thank you, that's good to have those time frames.
Yes.
And so you could change your profession by doing those things. So you have to get the prerequisites for nursing school, and then go to nursing school, and then get the master's degree. So there are quite a number of people who do this as a second career option, for sure.
Mm-hmm. Yeah, a mid-career switch.
Yeah.
Some people need that, I think.
Yeah.
And they're ready for that. Like, I have an undergraduate degree. I have my Bachelor of Science from a 4-year university at Appalachian. Even though I don't use it to be a doula, it did give me lots of different skills and definitely a love of just science and the process of the human body in general.
Yeah.
I think. But with doula trainings are typically only probably like a 20-hour intensive training, weekend trainings. And I've taken several different trainings through several different organizations. I always learn lots. But you would really only have to take one if you just wanted to focus like on labor and you want to become a labor birth doula. You would just take that. After you become trained, you can also become certified, and that's a different process that includes and involves extra examinations or answering questions, sometimes writing essays, sometimes attending births to be able to get to that certification level, which is just showing that you have more experience and that you're continuing to learn and grow and develop your career as a doula. So
I think a lot of people get involved in doula work because they were at their cousin's or their sister's birth, and they realize the importance of having that person there with them the entire time and having that continuity of that person. And so wouldn't you say that's probably, they either have a good or a bad, but they want to make it better, or they want to be that person for someone else. And I think just kind of seeing the possibility and then the need, because you'd never want a woman to labor alone. No. And that's just,
definitely never want anybody
never alone.
So what questions do you have for me?
Well, I was just thinking, so normally, people would probably ask me, how can I become one of those? If they'll, because they don't always know what a doula is, and so that the term isn't always out there. So it's good, I think, to educate on that. But people see the intentionality and the fact that there was this support person by the bedside, and I am speaking to just labor doula at this point. I just think it's such a great way to kind of connect them through you guys, just to say, actually in one full weekend you can learn so much, and you can start your process of the certification and becoming one. And you can I have a good friend who just did this with you guys, and she I think was so excited because it was kind of a career shift. She was a stay-at-home mom and then has decided to do this, and so she was just able to jump in, and she's able to give it all she's got, and she could just throw her passions in and go for it. And so I think that that's definitely needed, and makes it a little bit more not approachable, but it's just a little bit easier to get connected and to jump in.
Yes.
Is that I don't know.
I know Samantha, who I work with, her whole career goal was to become a certified nurse midwife. And so she thought that becoming a childbirth educator would be one path she could take to do that. She was also a medical assistant at an obstetrician office for the certified nurse midwife who worked there at the time. And so she kept gaining her skill set with that. And what she realized going through it is that she really loved that hands-on, non-medical aspects of it. And so a doula is non-medical. We don't have to make those calls.
So knowing that about yourself, knowing if you want to be more medical or not, that's an important distinction.
Definitely.
To know what your path.
So she was talking about that and how she decided not to go down that path. That wasn't the right one for her. But dueling is a jumping step for a lot of people who want to become certified nurse midwives or work with women in a medical capacity of some kind. It's something that you can do quicker. It's not years and years of training. So it is a good insight into what that might look like working with families.
Yeah,
for sure. Just working in birth and with just the support aspect.
Are there certain personality types that are really good for this job or really bad for this job?
I think that attuning to people is one of the skills that you learn and you get better at as you do it, because you have to be able to support everybody. I know as a certified nurse midwife, you don't get to make those decisions. As a doula, you can, and we often tell our clients, we want you to have the best fit for the doulas, and so if that personality, if that person doesn't jive with you, then we say, hey, I've got another doula that I think you might want to meet with. So that's something I do as the owner of High Country Doulas, to ensure that those families feel like they've got the right people, because birth and pregnancy and postpartum is a very intimate and vulnerable time, and you really do want to have those people that you feel comfortable with when you're in that vulnerable state. So it's really important. I would say that a good doula learns how to navigate supporting all types of people, and maybe the same as
that's good. I was going to say, I wouldn't say there's a bad personality type. I think that you would have to hone in some of your personality traits. And for example, if you tend to be a very forward or aggressive person, I think you would need to make sure that you are doing what's best for the mom and that you're not overstepping your boundaries. So I guess, for example, for a doula, not overstepping and making that situation really awkward for the mom, because now this relationship is strained, and now in front of the mother, and then it's making her situation not optimal. And so I think it's kind of taking your passions and maybe all, you know, if you tend to be a more aggressive person, maybe it's kind of taking that and honing it in and just rechanneling it. So I think it can be, you know, we say that childbirth is an art, and I think that maybe taking some of your personality traits and learning, like you were saying, if it's a good fit. So you want to have, maybe a mom wants a more assertive doula.
Yes.
You know, one to just get your face and say, you're going to do this. And so if you realize that your mom needs that, then absolutely, then use that. But you have to learn to read the mom and read her needs. And so I do think it's so important to really take a step back and read what that mom needs. And so from my angle, being more medical, I think sometimes it's good to have some assertiveness when things need to happen, right? But I also want to be sensitive to the mom and her desires and her desire to have her doula and her partner and, you know, all the people at the bedside. And so how can I help to do what I need to do medically and make sure that she has a safe birth, but I want it to be the birth that she wants it to be. So I think it's just it's an awareness. It really is an awareness of the other person. So
so in America's history, the United States history,
okay.
midwives have had a pretty negative stigma wrapped around them historically. They've been attacked quite a bit over the centuries. Some people may be adverse when they hear the word midwife. They're
Sure.
thinking natural childbirth, but that's not true, is it?
Okay, sure. So it kind of goes back to what we were saying about the different pathways of becoming a midwife.
Yeah.
And so there are midwives that are a little more cavalier and they don't necessarily do things by the textbook. And unfortunately, they may or may not be held to, they should be held to standards, but you know, sometimes they choose not to do them. And so it can make some people kind of leery because they feel like they're unsafe or they're practicing an unsafe practice. And so therefore, I think they can misrepresent the whole profession, you know? So you really do have to be careful no matter which pathway of midwifery you choose, that it is always a team effort and you're always looking to your OBGYN for backup and for their advice with difficult situations. And so we have to know our limits. We have to know what we're capable of and not capable of, and when to ask for help. That's another personality trait, as you were kind of talking about. So knowing when to ask for help. In all 50 states, midwives have different privileging, and so some can only do home births, and then some can work in hospital settings. And so the more direct entry midwives can only do home births. They cannot work in the hospital setting, and that's just for the, because we have the medical side of it. And so we have to uphold our medical licenses, and therefore we're able to work in a hospital setting. So that's just kind of the nature of that. And there are some great midwives that do direct entry and that are home birth and are really great at what they do. And unfortunately, they don't get noticed for that.
Yeah.
They don't get noticed for the great work. And, you know, just like with any other headline in the news, you only hear the negatives. And so I think midwives can get kind of a bad rap because we do want what's best for the mom, and we might think outside the box a little bit. And that can be maybe to a fault if it, you know, becomes a way that that a midwife is not seen as a popular decision. But ultimately, it's what's safe, and then what you can get creative with, going back to the art of it, and you know how a woman can be in a different position delivering as long as it's still safe. And so it might not be the favorable or popular decision, but as long as it's still safe for that mom, I think it's important that she knows her options and that your supporting OB also understands your intentions. So I don't know if they answered that question, but
Yes. And in this state of Tennessee,
yes.
as well as Virginia, there are direct entry midwives who are licensed and do support women who are interested in having home birth. So there are doulas out there also who support women having home birth. Our team only does hospital or birth center birth with high country doulas, but there's lots of other doulas who do support women who are doing home birth. And oftentimes direct entry midwives also have a apprentices who are working
Yeah.
with them, so they bring sort of their own doula with them. A lot of times it's just a different, avenue